Hello, my name is John Garcia. I'm the fire chief for the Pueblo of Laguna Fire and Rescue Program. The first thing I want to do is assure you that the dedicated men and women of the Fire Protection Program are going to continue to serve the community the best they can, as they always have been. COVID-19 is not going to affect our current operations. The way we work is to ensure that when you call for a service or any kind of an emergency, we'll be there no matter what. What we are going to do is we're ramping up our services to ensure that we have all the things that we need in order to protect the community. The first thing is we're going to make sure that we have all the safety precautions in place for our staff and for the community. Second, operational guidelines are going to be in place for how we transport patients from here to different locations within the area. Third, we're also looking at guidelines for our communications officers. When you call 911, we want to make sure that we serve you the best. And the only way to do that is for them to ask you a series of questions. So when you get these questions, please answer them the best you can. The next is making sure that we have personal protection for all of our staff. I think you hear that on a regular basis throughout the news, the media, how people don't have PPE. Personal protection equipment is important to all of us, and we're making sure that we have adequate for all of our staff. So don't get, how do I say this? Don't be afraid if you see our staff walk in wearing masks and goggles and gowns. It's for your protection as well as their protection. The other thing we're going to be doing is tracking all patients. So if we find a patient that doesn't quite meet the COVID-19 signs and symptoms, but they do have some kind of illness, maybe the flu, a cold or something, we're going to track and we're going to follow up with those patients to make sure that they're doing okay. If their conditions do get worse, we will work with them to take them into different hospitals or different types of care. The other thing we're going to do is make sure that our staff is aware of all the different things that are going on within the Pueblo itself. We have to be part of the community. We can't just be somebody that sits on the outside and looks in. We have to be aware of all that takes place within the Pueblo. What is COVID-19? I think a lot of people ask. COVID-19 is just a different strain of a virus that has mutated to something new. It's something that, for the most people, you're going to maybe feel some discomfort, maybe sniffling, cough, maybe it's just something that lasts for a couple of days. But some cases, you may have something that lasts for a week. Some cases, it may be something that requires you to go into the hospital because you're having trouble breathing or other types of symptoms. So for everybody, it's different. And so we have to know as an agency, as a fire and rescue program, how we manage those patients. So what we're doing is, if you feel that you may have the coronavirus or COVID-19, there's a couple of things you can do. First, the signs and symptoms of COVID-19 are a dry cough, a high fever, and trouble breathing. If you have all those symptoms but you're not sure, the first thing you can do is you can contact our number, and this number we have now is going to be the Pueblo of Laguna Information Hotline. The number is 328-5682. This number will help you determine if those signs and symptoms are something that we need to be concerned with. The last portion of it is, if you are truly experiencing a medical condition, you need to call our dispatch, the Laguna Communications, at 552-6666. That number will get you immediate rescue response, so we can find out what's going on, and if we need to take you to a hospital or if we need to treat you on scene. So you have these options, and these options are, sometimes we may go and do an assessment and ask you just to stay home, and we'll monitor your symptoms. Or there may be a time that we actually have to take you into a local hospital. It'll all be determined based on what's going on with your symptoms. Again, if you're experiencing trouble breathing or something that's considered a medical emergency, like a heart attack or anything else, please don't call the hotline. Please call the 552-6666. Now, what do we need to do it? We need to be a family. The only way we're going to make this work is to do this together. We have to take care of our elders, and the only way we can do that is the family participating, making sure they have food, medicines, and the support that they need in these times. Secondary is try to limit the amount of people that go into their home. Now, what do we do as individuals? Stay away from large crowds. Make sure that if you have to go someplace, it's important, like going to the grocery store to get what you need, going to the doctor's office, something that's considered important. Don't just go someplace because you can. Keep the distancing when you do go, and make sure you come right home. Make sure you continue to have good hygiene, wash your hands, make sure you don't touch your face, and again, just be cautious about your surroundings. If we do all these things together, as a group, as a family, we'll get through this. And I want you to know that the Laguna Fire Protection Program will always be here for you. Last thing is misinformation. In order for us to make sure that you get proper information specific to the Pueblo, is that you look at the Pueblo's website or our hotline. You have to remember that the state of New Mexico has hotlines, the counties have hotlines, all these other agencies have hotlines, websites, and information that may not be valid for the Pueblo. So if you want information that's specific to Laguna Pueblo, please go to the website, call our hotline, or in some cases, if you have to, based on certain types of emergency, call our communication center at 552-6666. Thank you and have a nice day.